So this is an overview of all the skills that we will be covering in this course. Today we're going to be just looking at paraphrasing, but by the end of the course you'll have a good sense of all of these. And hopefully you noticed some of them in the video you watched last week. So what do we mean by attending behaviour? Well, it's not just showing up, it's actually showing that we are listening and supporting and following what the client's saying. So it's supporting your client with individually and culturally appropriate verbal, following, visuals, vocal quality, and body language. And that culturally appropriate is really important because what's appropriate for one culture in terms of, for example, eye contact may be inappropriate for another one. So we'll talk more about that. And listening is the central skill in attending behaviour. So if we don't listen, we're not attending. And it's the core to developing that relationship with our clients. It's the first step. So how do we show we're listening? Well, one of the first ways we do it is by using minimal encouragers. And that's things that you may have noticed yourself doing in the exercise last week where we asked you to listen to your client but not say anything. So you might have found yourself going, nodding and smiling and that kind of thing. So that would be non-verbal encouragers. Then you can use verbal encouragers as yes, sure, go on, absolutely, that kind of thing. And that indicates to the client that, yeah, you're with them, you hear them, you understand, that kind of thing. Puts the client at ease without interrupting the dialogue. So it lets the client know that you're listening without actually stopping their train of thought. So some of you last week when you were clients said, I kind of wanted them to say something because then I just found myself repeating myself when they didn't say anything. So giving a minimal encourager will help the client feel heard. So the key to a minimal encourager is that you should barely notice that it's happening. So your minimal encourager shouldn't be really noticeable in the conversation. So it should be just enough to keep people going and feel like, yes, you're there with them. It shouldn't take too long to say and therefore interrupt the flow of conversation. And that's what we mean by minimal. So make it as minimal as possible, but still showing that you're with the client and hearing what they're saying. So silence. We had some good reflections on silence last week in the tutorial and what it felt like to not say anything when your client's talking. And some of you felt pretty uncomfortable with the silence. They really felt like they wanted to say something. It's important to acknowledge that most of us are pretty uncomfortable with silence, and it's general human nature to want to fill the silence with something, a question or a statement or something like that, just because it's not natural. It doesn't seem natural to sit in silence. However, we can use silence, therapeutically. It can be a useful thing to use. So that's why we got you to practice that and to start to expose you to learning to sit in silence. So what can make silence effective is that it enables you to be less directive in the direction that the client's going. So by not always jumping in when a client has finished talking, it allows the client to decide the next line of conversation or of processing that they want to go down. So it stops you from directing where things are going all the time. It keeps the client as the expert rather than the counsellor as the expert. So to allow enough pause time gives the client the ability and the opportunity to process what they've just said and then add to it. So it's not us always interpreting what the client's just said. It gives them that chance to do that for themselves. Reduces the power differential, again, because you're being less directive and less of an expert. Allows the client to process their thoughts and feelings, and sometimes there just needs to be a little bit of space. So if someone says something that's very powerful and maybe they haven't admitted it to themselves before, that maybe they don't want to be in this relationship anymore, that they are feeling grief for the loss of something, and maybe they have never verbalized it before, and they just need a moment to just process that before they go on. So it's important we're not always jumping in whenever there's a space in the conversation. And silence also gives permission for people to have tears or to have emotions. So if we see someone that's upset, we don't always want to jump in and say, oh, it's okay, you'll be fine. We need to allow the client to feel things, because sometimes that can be healing in itself. That can help them process and enable them to express what they're feeling, and therefore feel a little bit of relief from that feeling. So when someone's crying in front of us, it's important not to try and intervene all the time. It's not about sitting back and not engaging with them at all, but it's just sitting with them. And sometimes people will they'll see someone crying and then they'll go to pat them on the shoulder and say, oh, it's okay, or give them a tissue. But that's not really necessary. Sometimes just sitting with someone while they're crying is very powerful, because it gives them permission. Silence is golden sometimes. So sometimes silence is not all that useful. Sometimes it can be emotional. So sometimes when a client has said something very emotional and they need time to process that big feeling, so it's emotional silence. Sometimes it's reflective. So sometimes a client is reflecting on some content, or maybe they're reflecting on a link between maybe how they're feeling now to something that's happened in the past. So maybe that's reflective. And sometimes silence can be disengaged. So we need to watch out for that. And if a silence is indicating that the client is disengaged, then we want to intervene with some more directive questions and so on. Also, if the counsellor isn't disengaged too, we want to watch out for that as well, because that's the opposite of what we're trying to achieve. And on the slide, there's some interesting articles on silence that you can have a look at. So non-verbal communication is very, very important when we're talking to people in distress. So there are a few different areas that we can think of when we're talking about non-verbal communication. The first one is what we wear, because that communicates something. So it's important that we dress according to our context. So obviously, if you are going into a drug and alcohol service, then you may not want to wear a three-piece suit. Yeah, if you're working with disadvantaged youths, you want to dress in a more accessible manner, whilst also looking professional. Yeah. Additionally, it's important that we dress in a way that communicates that we care enough to make an effort with our appearance. We care enough about our service users or our students or our staff and so on, that we're not turning up sloppy. Eye contact, that's a really big one. And a few people were asking about that last week. So we need enough eye contact to show that we're listening, that we're engaged, but not so much that we're staring. Yeah, so be aware of what feels like a more natural amount of eye contact. It's also important to be aware of cultural differences. Some cultures, for example, some Indigenous groups may feel less comfortable with eye contact than others. And this is not to say that all Indigenous people do not want you to make eye contact, because that's not the case. But we need to be aware that in some groups, for some people, there's differing levels of comfort with eye contact. So the best way to go is to be led by your client. So watch what they're doing, watch how much eye contact they're giving you, and follow their lead. Body position. So usually you don't want to be kind of leaning back and, you know, looking like you're sitting back on the beach and disengaged. So you want to be kind of looking like you're engaged in what they have to say, you know, leaning slightly forward, possibly. And thinking about, this relates to personal space as well, how close you might be sitting to the client. And we can talk about this in the tutorials about how close you might sit to your client, but think about for yourself, how close would you like someone to sit in front of you in a chair before you feel uncomfortable? And everyone's a little bit different. So try and allow enough space for the person to pull their chair backwards a little bit if they're feeling uncomfortable with the level of closeness. So be aware that everyone's different in terms of how close they want you to sit. We also need to be aware of people who've been through trauma. So being trauma informed means that we need to be aware of some people are more vulnerable to being put in distress by people invading their personal space. So just watch people's reactions and follow accordingly. Facial expression. So we can communicate a lot with our facial expression. We can communicate disapproval, you know. We can communicate surprise. We can communicate approval. We can communicate empathy and care with our face, and happiness and that kind of thing. So make sure your facial expression is congruent, so it fits and is in line with what's being said in the session. So if someone is talking about something that's upsetting, make sure you don't have a smile on your face that's inappropriate to the situation. You know, so try and match what's going on with the way that you're presenting yourself. Touch. So we try and avoid touching when we're helping people, because we're not sure about how comfortable people are with touch. There's usually no need to invade people's personal space with touch, and we can do a lot by maintaining our professional boundaries and keeping it to being a professional relationship that doesn't involve touch. Voice tone and intonation. So, and also energy and liveliness. So the best way to go when you're talking with someone is to try and, to some degree, match their volume and level of liveliness and so on. So if someone has come in to talk to you and they're very quiet and they're speaking very slowly, we don't want to become very verbose and very loud and very energetic, because that will swamp them. So we need to try and come a little bit closer and meet them in the middle with how they're presenting and how we're presenting in terms of our voice tone and intonation and liveliness and that kind of thing. Equally, if someone is coming in and they've got, you know, really high energy and so on, we don't want to be, you know, have a very quiet, very slow tone of voice and liveliness, because we'll lose that client. We'll lose that engagement because we're not meeting them in the middle. So just watch the person that you're working with and try and meet them in the middle. So paraphrasing if there's only one thing you take out of doing this course, hopefully it's paraphrasing, because it's the key skill that we use in counselling. And if you can master paraphrasing, you can use it in so many different scenarios. You know, when you have difficult conversations with anyone, you can use paraphrasing, and to show anybody in your life that you're listening. So it's the most effective way to let someone know that we're really listening is to reflect back the content of what they're saying. So that's essentially what paraphrasing is. Now, this is the counselling session that I put the link up to last week. I'd like you to have a look at it again, and see if you can point out to yourself where the counsellor uses paraphrasing. So paraphrasing or reflecting content means to reflect back to the person what they've said. So it's not about parroting. Parroting is saying the words, the exact same words that the person has said back to them. And that's usually not very helpful because it doesn't really give them anything new. So, but paraphrasing is about picking out the most important content and details and putting them in your own words. And that is harder than it sounds. So the purpose of paraphrasing is understanding, being heard. It reflects back what the client has said. It's not an interpretation. Nothing new is added. It helps the client hear back what they're saying, and that can help them process and work out a problem and see things that maybe they're overlooking. It can help keep the dialogue on track, so it can help keep the conversation on track. When the person hears back what they're saying, goes, yeah, that's right, and can carry on discussing the problem. It offers clients opportunities to revise the dialogue so far. So it gives clients an opportunity to say, yeah, that's sort of it, but this is what I'm really trying to say. So some examples of getting started with a paraphrase could be something like, so you're saying that, blah, blah, blah. So you just said that, or I heard you saying, if I heard you right, so I'm hearing that, or so it seems like. So those are good kind of starting phrases for a paraphrase. Now, it's important that you remain tentative when you're making a paraphrase. So be open to being wrong with your paraphrase. So it's a way of checking in to see if you've heard the client correctly. So when you make your paraphrase, say, so it seems like things have got really tough at university lately. Is that right? So you're not assuming that you are correct, you're just checking in with the client. So an example, I've never stayed in one place for more than a couple of years. In the last few months, I've lived in 5 different houses. It's hardly worth unpacking when I move now because I know I'll move on again. I just can't settle. So a paraphrase will pick out the key points in that. So you might say something like, so it sounds like because you've moved so much in the last few years, it's become really hard for you to settle. And so that might communicate to the client that you really understand, you know, the point of what they've said, and then they can explain a little bit more about what makes it difficult to settle. So it's important to know that each counsellor will paraphrase in their own way. So in the tutorials, we're going to be doing some examples and working out some ways to paraphrase different different vignettes, and everyone will come up with a different way to express it, and that's perfectly okay. Two counsellors listening to the same statement will reflect it back in different ways, and there's no perfect responses. So with practicing, you'll learn to be able to pick out the key points in what someone's saying and reflect it back. The most important thing is that we're not reflecting back any judgments or assumptions, we're just reflecting back the content. So in the tutorials, we are going to practice that. We're going to practice writing down some paraphrasing, but also in our triads, we're going to be practicing as counsellor, paraphrasing back what your client's saying. So no longer sitting in silence, actually using some skills. So I hope you enjoy that, and you've got something from this lecture, and let me know if you have any questions.